All right, well, we'll get going. I've got a little introduction and then I'll pass it off to you. So,
Okay.
Hi everyone, welcome to our webinar today, which is Navigating the Transition of Healthcare. We're joined today by Kathy from Proactive Seniors. My name's Emma Tornero. I'm a Client Service Coordinator with Parkinson Association of Alberta, and I'll be moderating this webinar. If you have any questions during the webinar, I'll start the chat, and so you can submit the questions in the chat. We can stop kind of periodically or at the end and go through some of the questions there. So feel free to send them in. Just a disclaimer, this webinar is being recorded and all the information provided in the videos by Parkinson Association of Alberta and our featured speaker are furnished strictly for educational and entertainment purposes only. The service is not intended to be diagnostic, prescriptive, or replace the relationship, advice, and or care of your physician. And general questions about symptoms, treatment, available medication, complementary and alternative healthcare therapies, and current research will be fielded. So Kathy, we're very happy that you could join us and present today, and I will pass it off to you.
Thanks, Emma. Hi, everyone. First, I'll apologize for my messy background of my office. I was trying to hide it, but I don't know how to do that. Just ignore the background. Nice to have you all here, and I'm going to share my screen, and then we can get started. And this presentation is on housing and seniors housing, and as Emma said, it can be very casual. There's just a small group of us. So if you have questions, I'm happy to answer them as we go along. Emma, you can just maybe tell me if there's questions because I probably won't notice. And or you can save them to the end and we can have a chat and talk about whatever questions you might have. I'm very happy to answer any questions that come up. Okay, so into seniors housing, I'm going to make sure I get the right screen here. Is that working, Emma?
Yes.
You can see it? Okay, great. Okay, so back up. Oops, this is complicated because we have a little video there. So the company I am with is called Proactive Seniors. It's actually my company, and we're located here in Calgary, and we have an office in Edmonton and in Kelowna. I'll just talk a couple screens about who we are, so there's a bit of context, and then we'll get into the information on seniors housing. Let's see if I can move this screen. There we go. Okay, so yeah, we're going to talk about making the move, when's the right time to consider retirement residences, and just kind of some basic info, kind of seniors housing 101, like what do you need to know to even understand what seniors housing is all about. So this is a quick little video about our company. It'll be 1 minute.
As we grow older, planning for the future can be overwhelming. We can feel frustrated, not knowing where to find help. Choosing the right path and making the right decisions is hard. But with Proactive Seniors, we do the hard work for you so you can be at ease. Through our expansive network of resources, we build a plan that fits your needs and wishes. Whether you are hoping to stay at home, move to a retirement residence, or are caring for a loved one, our team of experts will help you navigate the complicated world of senior supports and seniors housing. We are your information resource, your family liaison, your on-call advisor, your advocate, system navigator, and companion on this journey we call life. Plan ahead. Live well. Proactive Seniors.
Okay, so this is just our group. There's actually 3 more of us that need to get into this picture, but so we're a group of advisors from different backgrounds in health and seniors housing and pharmacy and gerontology, and we've all come together to kind of provide a really broad-based, comprehensive advisory service to seniors. And the 2 main areas that we work in are for seniors that want to stay in their home. We help to build a really comprehensive plan so that they have all the information and resources and support they need to be able to do that successfully. Or for seniors who do decide they need to move or have to move into some kind of seniors residence, then we have advisors that know everything there is to know about all of the different options in Calgary and surrounding areas, and can help people get the information to make their best choice into the best place that they can get into. So it's a little bit about us. And then the third service we offer, we call it family support for our clients that are either in our planning service or our housing support, we help to just kind of fill in the little gaps. So if they need to get to the doctor and they don't have someone who can get them there, we just have a couple people on our team who can do that kind of a thing, because we don't want things to go sideways because of those little issues that crop up. And then the other service that we help is caregiving coaching. So a lot of our families, the spouse is the caregiver, and they can really use some advice and tips and strategies. And so we can help them through that, because it can be a bit of a challenging role to have. Okay, so making a move. When's it time to consider seniors housing? So first, talk about what are some of the reasons that seniors decide to move, or what are the triggers that make them think, okay, maybe staying at home isn't the right solution anymore. And I kind of liken it to this risk-reward balance scale. So at what point does the reward of staying home start to get outweighed by the risk of staying home? And it's different for everybody. I mean, lots of people can stay home for their entire life. They can stay home right till the end of life. They can palliate at home. It can be done. We help people do that all the time. But it's not always the right strategy or route for everybody. And these are kind of the common reasons why seniors will often decide to move into a more supported living setting. One is they're not eating properly at home, or they're not thriving at home. And that can be from a number of different reasons. But generally, being at home all on their own, or even if they're a couple, and just, not getting out and not, cooking proper meals and not kind of taking as good care of yourselves as you might if you had some help to do so, can be a common reasons why people move to a seniors residence, where meals are provided and other supports are provided. And we actually had a student that did a survey of all of our past clients. And one of the comments that this couple said, she said, "Oh my gosh, we are just feeling so much better now that we're eating proper meals. We didn't realize that we weren't eating, proper sustaining meals. And now that we're being fed better, we're feeling so much better." So that was really nice to hear. Another reason seniors often move is just that social isolation of being at home. Maybe your neighbors have moved away and your kids don't live in town. Perhaps you're not driving any longer, or maybe you've lost your spouse. And it can be really detrimental to your physical health, your mental health, your cognitive health, to be socially isolated. And, we all saw that in spades over COVID, how challenging it was on everybody to be isolated. And so that's a really significant reason why people might choose to go to a seniors residence, is just to have other people around and easy access to activities and programs and stuff without having to drive there. So another really common reason people might decide to move is their home isn't suitable for aging in place. And it might be that it's unsafe. We've got lots of clients who live in older houses and they don't have a bathroom on the main floor. So they have to go up and down the stairs to get to the bathroom, or up and down the stairs to get to their bedroom, or down to the basement to get to their laundry. And it just isn't a safe environment for them, and with their current mobility issues, or houses that are just simply unsuitable. We had a family a while ago, a beautiful home. It was just lovely, and it was a bungalow, but it had like a sunken living room, and then 4 steps up to the kitchen, and then a sunken den and office, and then everywhere were like these little steps everywhere. And the lady living in the house had a walker, and she just couldn't get around her house, and it was going to be way too complicated to modify it. So sometimes the house is just not suited for living in as you get older. Another reason is the upkeep of the house, doing the maintenance and the housekeeping, and just all of those things. You can certainly bring people in to help with that, but sometimes people just say, "I've had enough. I'd rather go where I don't have to worry about the roof and the downspouts and everything." A really important one is this idea of the cost and or the complexity of care. So you can bring in anything to your house. You can bring in public home care, private home care, people to make your meals, people to do the house maintenance, someone to do your laundry, someone to do exercises with you. There is 1,000,001 services that can be brought into a home. But at some point, people think, for me, this is too complicated. I've got all these people coming and going. It's hard to manage the schedule, or it's starting to get quite expensive having all these different services supporting me to stay in my home. So it's a different threshold for everybody, but people might realize that it's just getting too complicated. Another really good example of that is having home care support. So you can get home care to come in, public home care, and they'll come, usually morning and evening, 15, 20 minutes, they'll do their thing and they'll go. Or you can have a private home care company come in and they'll want to come for a significant chunk, like 3 or 4 hours once a day. And they'll do all their things that they need to do and then they'll go. But sometimes the care someone needs is actually 5 minutes of help 8 times during the day, like a little bit of help, but spread across the day. And that is really hard to organize with home care. And so that might be a reason where people will say, this is too complicated. I'll go to where the care is. And then the caregivers in the residence can come and help me briefly throughout the day, as opposed to having a chunk of time when I have to sort of do everything. So that's a good example of complexity of care. Inflation of expenses at home, sometimes it just becomes more costly to live at home than in a retirement residence. And we always have people say, oh my gosh, these seniors residences are so expensive. And I'm not saying that they're not, but often when people budget out how much they're spending for the home maintenance and all of the care and, their insurance and their property taxes and all that stuff, it very often ends up being very comparable. So sometimes people just feel like it's too expensive to stay at home. And another concept on that is the idea of having all of your money in the asset of your house. So some people can actually say, well, we're not poor or we don't have no income, but all of our asset is in the home. And then we can't also afford to pay for all of these services and stuff that need to come and support us to stay in the home. It's kind of like, what is it called? House poor or something like that, where you actually have an asset, but you don't have access to that money. So some people will say, sell the house, have that money, use it to move into a residence where you can get the care and support that you need. Family caregiver burnout is a really significant reason why people will move. And more often than not, it's the spouse who's the caregiver who's burning out. They just are running out of steam. And so by moving into a senior's residence with their loved one, it allows the residents to take some of that care burden off, whether it's the housekeeping and the cleaning, or whether it's the actual care tasks, and it gives the spouse an opportunity to refresh and recharge. And, in this survey we did with our clients, this one lady said, we moved to the senior's residence for my husband, but I have just thrived here. I can do the things I need to do and spend time with him as his spouse instead of his caregiver. So that's kind of a good example of where it works really well for both partners. And then the final reason why people decide to move, sometimes it's just simply a lifestyle decision. It can be a really nice way of living, lock and leave if you travel in the winter, that kind of stuff. So those tend to be the primary reasons why people might move to a senior's residence. And maybe some of those might ring true for you guys. Some of the common challenges with making that decision. So a lot of people know or want to downsize and move into a senior's residence, but the whole idea of doing it is what's stopping them. So that's where we can come in and help with that whole process of figuring out where's the best place to go. What are the steps you need to take to get that happening? What are the services that can support you? So it can be very overwhelming. In Calgary, there's over 250 seniors residence buildings. And so picking one can be really hard. Another reason why people have struggled with the decision is the misconceptions. Hear this every day. Oh, you know what? I had my mom in a nursing home. I absolutely do not want that for me. I totally get that. I wouldn't want that for me either. but things are different now. There's multiple levels of care. We'll talk about that in a few minutes. And there's so much more life and activity and programming and stuff that you can find in these seniors residences. So I think a lot of people go in thinking it's one thing and are very pleasantly surprised when they've toured a couple places, and they always say, I had no idea. This is way better than I thought it would be. So don't let those misconceptions hold you back from at least looking at what that lifestyle might be like. Downsizing distress. So that whole concept of what do I do with all of my stuff? Huge challenge for a lot of people. People have lived in their houses for 50 or 60 years. They got a lot of stuff they need to sort through. There are so many little companies that help with that now. I can probably name 12 on my hand that we know of that help with downsizing. So there are people that can help. They walk you through it. They help. If that's the barrier, there is a solution to that. Another challenge is putting it off too long. This is a really important one. Public seniors housing, which we'll talk about, they have to take a person. They can't say no, but they're going to decide what level of care someone goes into. So being in assisted living can be a lot less institutional feeling than being in long-term care. And if you wait too long, you might miss the boat on assisted living and you kind of have to go to long-term care. That's not a terrible outcome, but it certainly is nicer to have the options of assisted living if you're a little bit more proactive about making the decision. And similarly, in the private market, there's tons of private residences. They don't have to take you. They will do an assessment and they will say, your care needs fall within what we can handle, or they don't. And so surprisingly, people think, oh, I'm going to go to such and such a place, but I'm going to leave it right until I absolutely have to move. And then they go to move and the facility says, well, when we saw you 2 years ago, you were suitable for what we offer, but you're not anymore. So now you have to go look for something of a higher care level. So putting it off too long can end up backfiring a little bit. And then another challenge people have is the guilt. And this really plays in a lot when it's the family or a spouse that's having to make this decision for a loved one who needs to go into care. But we see it time and again where the person isn't thriving at home. They're not safe at home. They're not getting the care and support that they need anymore at home, not for lack of effort, just because it's so challenging. And moving a loved one into the right facility where they're getting the right care can be very much the right thing to do for someone. And it's just about finding a place where they can really be happy and feel comfortable in. So it takes a bit of time to do it right, but it's a guilt is something that I think people have a hard time getting past, but often it's very much the right thing to do. Okay, next slide. Categories of seniors housing. So this is where this is the overwhelm that people feel. Like I said, there's like over 250 seniors housing options in Calgary, and people are just, their mind is blown as to how do they figure out what's the right one for them. So I've tried to sort of simplify it into 3 categories of type of care and 3 categories of who pays for that care. So I'll walk through this a little bit. So the categories or levels of care: independent living, supportive living, and long-term care. Now, of course, between the public and the private system, they use different words, which makes it very confusing. But in independent living, essentially that means you can manage your own care and support. You can get home care in if you need a little bit of help, but you're not getting care generally from the facility. You're kind of living as you would at home, but maybe you're going a place where meals are provided or not. My mom's 80, she's in independent living. There's no meals where she is, but there's all the other social stuff. But you're essentially managing your own support. So independent living in the public system is called either lodge care or SL2 or SL3, which stands for supported living 2, supported living 3, or independent living. So that level where you're kind of managing your own stuff, and you're maybe having meals, maybe having housekeeping, definitely having activities and programming going on, that can be paid for through subsidized seniors housing. So that's for low income seniors, or privately. So AHS does not fund independent living. So when I say subsidized, if you are a lower income senior, which means your income is below, your annual income on your tax return is below a threshold, different threshold for singles and couples. If it's below that threshold, you're eligible for subsidized independent living. And your rent is called rent geared to income. So if you make $1,000 a month, you would pay 30% of that as your rent. If you make $100 a month, well, that's probably too low because you have to have a certain amount to be able to pay. If you make $500 a month, then you pay 30% of that. So, so it's called rent geared to income. It's very accessible, very long wait lists, probably not surprisingly. There are some really lovely subsidized buildings, but you have to be planning ahead because you might be waiting 18 to 24 months to get in. We're very successful at getting people into subsidized housing because we know exactly how to fill out all the paperwork. So that's kind of funded by the province, and alternately, independent living, you can pay privately out of pocket. So next category is supported living, also called assisted living, also called SL4 or SL4D, which is supportive living dementia care. So that is where there is care on site, and you might be getting care, once a day, 3 times a day, once a week, but the care is there, it's in the building, it's available as needed. That can be accessed through AHS funded sites where they pay for the care and you pay for your room and board. It's $2,200 a month, regardless of where you go. There's about 45 buildings in the city that are through AHS, or you can pay for that privately. We'll go into the details of what you get as a private assisted living later, but that's how you would access that assisted living level of care. And then the third level is long-term care. Used to be what people would refer to as nursing home. That's where the nursing care is continual throughout the day. You have pretty high care needs. Maybe you need a lift transfer. You've got narcotic pain management or significant incontinence issues. Long-term care is pretty high level of care. The nurses and care staff can help you throughout the day. It doesn't have to be scheduled. That as well is funded through AHS, like 95% of it, and then 5% people access through private pay options. So those are the 3 levels of care. Those are the 3 sources of where the money comes from. All right, hopefully that helps to simplify it a little bit. So let's talk about these different levels of care. So independent living, as I talked about, you're kind of managing your own everything. You can have home care and if you need it, but the care isn't necessarily in the facility. If you're paying for that privately, one of the lowest price independent living suites is around $1,800 a month, and it can go up from there to really expensive. There's some really, really nice places. Privately, you can have a studio, a 1-bedroom, a 2-bedroom. You can have any size of suite. You can have a place that provides all the meals. You can have a place that provides some of the meals. You can have a full kitchen. You can have just a partial kitchen. There's lots and lots of different options in that private area. If you're looking at it from a subsidized perspective, then you're usually getting a 1-bedroom or a 2-bedroom apartment. There's no meals, no activities, no care, or you're moving into a lodge setting, which would be a studio suite, meals and activities are provided, and that's around 70% of your rent geared to income. So that's independent living. There's not a lot of new independent living buildings coming on the market because these providers have realized, the private companies have realized that once people move in, they don't want to have to move again once they need assisted living. So there's still a handful of buildings that are strictly independent living, and they're very strict about that. When people start to have higher care needs, they have to move on. They are appealing to the senior who's quite active and doesn't need any care and doesn't want to be around people that need care. They want everyone to be active and at that same level that they're at. But I'd say more often than not, most buildings have independent living and assisted living in them. And some even have long-term care in them as well, because people don't want to have to move. We call that kind of age in place strategy. So that's the way things are going. It's quite funny because some of these new buildings, they open up and they say, oh, we're going to be totally independent living. This is a lifestyle location. You give them 2 years and all of a sudden they start providing care because they realize that's not really what people want anymore. So it's nice to be on independent living. Okay, next is supported living. So this is where there's care on site. Ideally, the care is scheduled and they're coming on a regular schedule, get you up in the morning, give you some pills at lunchtime, help you getting back to bed. But there is care 24 hours in case there's an emergency. In the public sector, it's always a studio suite. The fee is $2,200 a month. There's about 45 buildings that offer supported living, which is SL4 or SL4D. SL4D means it's a secure memory care unit for people with dementia. It's hard to accommodate couples in AHS funded supported living. Some places will have side-by-side suites, but both parties need to have the same care level. So that can be really hard that doesn't really work most of the time. No pets, no smoking. You kind of get what you get. They're all the same offering, just different buildings. Some are nicer, some are a little older, that kind of thing. So that's public supported living. Wait lists, pretty long wait lists, especially to get into the nicer places. So again, you have to be strategic and be planning ahead. In the private sector for assisted living or supported living, again, same as independent, you can have a studio, a 1-bedroom, a 2-bedroom. You can pay anywhere from $2,800 a month to the highest we've seen is $16,000 a month. You can have a place that has a pool and a golf, putting range and a, wine bar, and you can have places that are really basic and don't have a lot of those sort of extra amenities. But, the best thing is to think about what's the best fit for you, because the best fit for one person isn't the best fit for someone else. People ask me every day, which is the best place? And I say, it depends on what's best for that person. Meals can be included, partially included, kitchens, laundry, that kind of stuff. So lots and lots of different variety in private supported living. And again, I say 40 buildings. This is a bit of an old slide. It's probably closer to 45 or 50 buildings in the city. Something that's interesting for people is that some buildings will have both public and private in them. And that can be a really interesting option because you might start off paying privately while you're on the wait list for something publicly in the same building. So we can help people figure out all of those different scenarios as well. Okay, and then long-term care. Long-term care, again, is that higher care needs. Most of it's provided through AHS, same fee schedule, $2,200 a month. Usually it's a studio suite. Some of the older buildings will have shared suites, but they're really starting to phase those out. There's a lot of care available and everything's kind of included. There are starting to become some private long-term care options. They're not allowed to call it long-term care because that's an AHS term. So they call it enhanced care, but they're providing that higher level of care, 24/7, quite heavy nursing support. There's at least 6, maybe even 7 or 8 now private residences that provide that level of care, but it's quite expensive. You might be paying anywhere from $8,000 to $9,000 a month just to start for that higher level of care. So it certainly is a way for people to get into long-term care and have a place of their choice and have it to be quite a nice location and to get in quickly, but that does cost quite a bit of money. So we need to sort of know that as well. Okay, so how do you pick a place? Well, this is what we do. So we really feel like the most important thing is finding the best fit for each individual person. So this little map just shows a bit of our database. Like there's a lot of choices out there, and finding the right fit really matters. When it's the right fit, the seniors thrive. Like we hear it every day, how much better they're doing, how happy they are, wish they'd done it earlier. It's about finding the right fit. It can be a really great way to improve that relationship with the family. If the family or the spouse is doing a lot of the care, it can be quite hard on the relationship. And moving into a site where the care is being provided just really helps everybody get back to that dynamic that they had before all that caregiving was required. So writing the right fit is really important. When you don't have the right fit, we'll have people that call us and say, my loved one is so unhappy, they're not thriving, they're just giving up. And that's because they're in the wrong place for them and they need to be in a different location. We've had people reach out to us that have moved 2 and 3 times before they talk to us and say, can you find us something that's actually the right fit? So that's really important, to put the effort into making a good informed choice. We have people that have called us because they've run out of money. They've moved into a place that was outside their long-term budget and they've burnt through all of their savings, and then they have to move into something significantly less than what they're used to because they've run out of money. So somebody, talked them into paying for something that they shouldn't be paying for. They should have been in a place earlier on that they could afford for the long duration. So finances is a really important consideration, and we see people that overspend and then they end up running out of money, like I said, but we see people that underspend too, and they've got the capacity to be in a place that really fits all of their criteria, but they say they want to be in something that's under a certain budget. And maybe they're saving their money for their kids or something like that. And almost always the kids will say, Mom and Dad, please, for goodness sake, spend something on yourself. And so it's about finding what's the right fit budget-wise as well, and within your comfort zone. Maybe just because you can spend a lot of money on a place doesn't mean you feel comfortable spending a lot of money on a place. So everybody has different criteria. And the key thing is to figure out what those criteria are and then find the best match. Maybe I'll back up here. So one of the other things that I think is really important when we're helping people with finding their best location is it's not always just what checks off the boxes. In-suite laundry, it's got a balcony, I can have my cat, and there's a swimming pool because I like to do laps. Fine, it checks off all the boxes. That's important. But it's also important to know what's the quality of this place. And so this is where our advice can really be helpful too, because maybe we know that the management just changed over and everybody's new on the staff, or, they've decided they're going to sell themselves to another company. And so everyone's just kind of given up for a while, or what have you. So it's important to also know what's going on behind the scenes. And you don't get that from a salesperson at the facilities. You have to sort of ask someone who's not trying to get you to buy a suite there or rent a suite. So those things are important too. Just kind of put that little plug in for your thinking. So things to consider. The aging in place concept. Do you want to be in a place where it's independent, everybody's active and busy and doing their stuff? That's fantastic. Or do you want to be in a place that you can stay in for a longer duration? So that age in place concept, I think, is getting to really be most people's preference. Creatively mixing and matching public and private. I talked a little bit about that. If you're waiting to get into a public location and it's got a 24-month wait list, well, maybe we can strategize how you can be nearby or in the same building or something like that in a private place temporarily. On the other side of the coin, we have people that reach out to us and they say, I guess I need a private assisted living. And, we meet them and we understand what their criteria are, and they're not very active and they're not getting out of their room and they're not, going to participate in all of the things that are being offered in a particular location. And we say, well, why don't we find you a good public location? You're going to have, a similar experience, and then you can spend some of that extra money on a companion to take you out to, lunch once a week, or to give you an extra shower twice a week, because the public system has kind of limitations on those kind of things. So it's finding the right kind of combination of care for the right person. Understanding your financial position. I know I just talked about that. It's really important to know early on what it is you are interested in and what it might cost, so that you can plan that in your retirement planning budget. And then the timing. The timing is important. If you know this is something you're going to need eventually, think about not waiting too long, because you're going to have less options. And Timing is important, just talked about that. The wait lists. Yeah, so there are starting to become some wait lists in the private market. There's a bunch of new buildings that are a little bit delayed because of COVID and supply chain stuff. So there's starting to be some wait lists privately. You can put a deposit down when there's a wait list to hold a spot. That's a pretty good strategy. Publicly, there are always wait lists, both public and subsidized. And so, if you are having to move because there's a crisis, someone's been in the hospital, they can't go home, you might just get put in what they call a first available placement. So reach out to us and we can help strategize how to minimize the challenge of that. But, planning ahead is really, really key when there are waitlist situations. Know your trigger points and your tipping point. Think ahead. Like if you're planning to stay home for, 3 months, 6 months, a year, 2 years, if home is your goal still for the time being, that is fantastic. Fully support that. But think ahead about what are the triggers that might mean you're ready to move. I'm not driving anymore. I need to have, multiple caregivers come into the house. We need to put a new roof on. Think about what those triggers are so that you can start to keep an eye on when those triggers are coming or that tipping point is coming, and be prepared for that next step 12 to 18 months ahead, because that's the timing you should be thinking of, 12 to 18 months ahead. Okay, that's it. Great. I'm going to unshare screen because I'm tired of looking at just my screens and not seeing anybody. But any questions? There seems to be only one chat question here.
It was me just getting the chat ready.
Oh, good. Okay. Yeah.
I'll give folks another minute to type if they have any.
Or they can just talk.
Yep.
They want to unmute themselves. Happy to answer any questions. Was that too much information, Emma? Did I overload people?
No, I think that was great information to have, and it's important to know to make the choices.
It's a bit much, I know, but it's not as complicated as it sounds once you sort of start to dig into it a little bit. No questions, anybody? Happy to answer anything you are wondering about. You can ask me anything. I may or may not answer anything, but okay, Henry and Terry.
Yeah, hi. We're in Edmonton, and I'd like to know how many buildings are in Edmonton compared to, you mentioned Calgary and multiple buildings.
Oh, I'm so glad you're in Edmonton because we have an advisor there, Shauna. She's so lovely. It's about the same. It's about the same number of buildings. Maybe it's just slightly less because Edmonton's population is less, but I'd have to look on our database and see, but we have all of the data on all of the locations across all of Alberta, just not off the top of my head. But there's probably, 30 or so private locations and probably 30 or so public locations at that assisted living level.
Okay, thank you.
Yeah, no problem.
And when you say Edmonton, does that include kind of the surrounding communities as well? Or is that just in the city of Edmonton? Yeah,
no, I would say that's just the city of Edmonton. All of the little surrounding communities have a handful. Like Red Deer's got some great places, and some of the little smaller towns have options too. So yeah, we've had clients from all over the province that are, needing to make choices. And we get a lot of people that are moving into Alberta because they've gone to retire in BC and they come back. Because they can't get a doctor there, or maybe they're moving to Alberta because their kids are here and they're out east or in Halifax or wherever. So yeah, another question, Terry? I don't know, your hand's up again.
Sorry, I'm just didn't know how to remute myself. Thank you.
You're playing with the buttons. That's okay.
Yeah, that's right.
So yeah. Kathy, at the beginning, you mentioned that you guys are Calgary, Edmonton, and Kelowna, but you would take a more provincial approach if somebody outside those areas was needing support?
Yes, our staff are in Calgary, Edmonton, and Kelowna, and we love to do everything in person when we can. That's just, I think this works so much better when our advisors are in person working with a family, but we have had a handful of clients that we haven't worked with in person because we don't have a place in Grand Prairie or whatever. So we can help anywhere in the province. We've got all the data, but we just, we're here. Yeah.
Good to know.
Yeah.
Something that we had talked about before was self-managed care versus moving into care.
Oh, yeah. I remember you wanted me to talk about that. Okay.
Would you say self-managed care is something to use before the transition to a care facility or in place of transitioning to care?
I would say both. The answer to that is both, but there's something new. Are you familiar with the new client-directed home care?
You mentioned it, but
it's fantastic. So public health, public home care is free, which is fantastic. But over COVID, we really saw this happen, but even before it was a problem. They cannot keep up. They just can't keep up. And so they're not providing that great of a service in some cases because they can't get the staff and they can't get people to stay long enough. And there's too much transition anyways, it hasn't been going well. So they decided, public home care, in their wisdom, I have to give them full credit for this, that they're just not keeping up and they're not going to be able to keep up because things are getting busier and busier. So they started a new program called Client-Directed Home Care in November, where they now say, if you are approved for public home care, if you want, we'll provide the care with our caregivers that they contract out. If you don't, you can have the money and you can find your own caregiver. So it's fantastic. Those caregivers that you direct the money to have to be approved by Blue Cross because that's how the funding flows through. And you can use the money that you're approved with publicly to hire your own private caregiving agency. And then you can top it up and have more hours. You can do whatever you want with it. It just has to be directed towards that care. So it's fantastic. We are using it all of the time because people have more options now. Some people are staying with their public home caregiver because it's going well. But if it's not going well, this is an option. So it's fantastic. And that's called client-directed home care. It's new. It's very easy to manage. What you're talking about with self-managed care is the precursor to that, where it used to be that if you didn't want to use the public home care caregivers, they would assess you, they would give you partial funding, and you could use it to hire your own caregiver, but you had to be in charge of hiring that person. So you had to, if you hired them privately, you had to do their withholdings and their taxes and their insurance and all of that stuff. And it's quite complicated. So if you had an amazing caregiver and you knew you were going to keep them for a long time, it might be worth the effort. You have to take a course, you have to fill out a ton of paperwork. It was complicated and a lot of people weren't using it because it was so complicated. It still works in certain settings. It works for families who have children who require care and they know they're going to have a caregiver for many, many years, or for seniors who require care. And again, you know, it's going to be a long-term relationship. It might be worthwhile. Self-managed care, I think they're paying $23 an hour from public health towards that. And client-directed home care, they're paying $37. So I think numbers might be not totally accurate, but something like that. So you get a lot more money with the client-directed home care. So it's kind of better value and so much easier.
And client-directed home care, they would still come into a care facility and provide care if you made the transition, right?
No.
Oh.
So you cannot get client-directed home care in a facility. Okay. Yeah. And I hope they change that, but that's just one of their early rules. I think probably because they're just trying to get a handle on everything. There's been a lot of people saying, Fawn, I had this caregiver at home. Now I moved into a facility. I want to carry on with the care. At the moment, it's no, you can't use the funding once you move. But I hope they change that.
Okay, good to know.
Yeah. Yeah.
All right. Any other questions?
Feel free to reach out to me. Emma's got my contact information. If you have any questions or you just want to know how we do our planning for wanting to stay home, we always do a housing evaluation, even if you're staying home. If you want to know what your best options are, if you decide you need to move at some point, we're very happy to help. And I can just answer any questions too, if you have any. So.
Great.
Yeah, thanks, Emma.
Thank you so much. Thank you for joining us and sharing your wealth of knowledge. It's always great to hear. And thanks to those who were able to attend. This webinar was recorded, so we'll add it to our YouTube channel afterwards if you ever want to go back and view it. And then, like Kathy said, if you have questions and you want to get in contact, please reach out to me and I'd be happy to share that contact information.